9:01 a.m. and I'm going to hand it off to Mayor Adler to call the meeting of the Austin City Council to order.
Judge Brown, thank you, and thank you to you and to the court for inviting us to be part of your meeting this morning. It is January 19th. The time is 9:02. We're calling the City Council special called meeting for the COVID briefing to order, meeting being handled remotely. And by way of colleagues, I put on the message board the rules that Andy had put for the Commissioner's Court, just basically copied them over, so I think everybody's seen that. The one thing I did not mention is that it's the customary practice of the court to take comment even on discussion items. So it's my understanding that that's how we'll begin this morning. Judge, I turn the meeting back over to you.
Thank you, Mayor. And thanks everyone for being here today. It's really great that our two governmental entities are coming together, even if it's under these trying circumstances. Whether you live in Lakeway, Pflugerville, Lago Vista, Manor, Sunset Valley, Creedmoor, Elroy, Barcliff, or Austin, the virus is impacting all of us. It impacts our families, our friends, our colleagues, our local businesses, and it's our duty as public servants to work together. So I'm glad to be here with our friends and colleagues, Mayor Adler and the Austin City Council, and the Commissioners Gomez, Shea, Trevelyan, and Howard. Our task at hand could not be more important. We can make a difference and we can save lives by working well together, and I'm so glad that we are. So we're going to go to the public comment period. Nate, do we have any callers on the line?
Judge, we are currently screening one caller to determine which item they're calling in on. I assume it is this item, but we are still confirming.
Thank you.
Morning, everyone.
Morning.
Morning.
So while Nate is screening that, I'll just lay out kind of the order of the meeting that we're operating under. So to ensure the efficient use of Dr. Escott and Director Hayden's time and to manage the length of the briefing, we need to limit ourselves to one question in the order below. And I'll basically call the order for the Commissioner's Court, and then the Mayor would do the same for the City Council. And then if time permits, we could have a second round of questions. But the basic part is let's each ask one question, let Dr. Escott and Director Hayden respond as they see fit, and then so that everybody gets an equal chance to speak today. So we're going to go, we'll do the Commissioner's Court first and then the County Judge, and then it would be the City Council members, and then the Mayor, and then we would close the City Council meeting by the Mayor, and then I will close it for the County. Nate, is that caller screened?
Judge, we have screened the caller, and they're not calling about this item. They'll call back in this next session. They're on a different item.
Okay, sounds good. So the first briefing, so we're going to have the two briefings, let them give their briefing, and then we'll go to the questions. And the first question, I guess, based on our order would be Commissioner Gomez.
Judge, if I may?
Sure.
I just wanted to let everybody know I'm having to jump off this meeting at 10 o'clock. So I won't, any questions that I might have had, I'll ask separately from today. And thank you all for being here.
Thank you, Councilmember Poole. All right, Dr. Escott, if you are all set, let's go ahead and hear your briefing.
Thank you, Judge. I'm going to share my screen. And I hope that you all have received my slides in advance. Again, thank you for the opportunity to address both Commissioner's Court and City Council on this COVID-19 update. What I'm showing you here is the update on our new confirmed cases in Travis County. Yesterday we reported 686 new cases with a moving average of 663. That's a 60% increase since a month ago on December the 18th. Our record high new cases moving average was on Sunday at 701. And I'll talk more about the positivity and what this week is likely to bring in a few more slides. This slide is showing an update of the new admissions to the hospital. Again, this has been our key indicator for our risk-based staging. The admissions yesterday was 78, with a moving average of 88. That's a 76% increase since last month. I'm happy to say that we hit our peak 9 days ago. That peak was 94. Since then, we've seen some oscillations between about 83 and 88. So again, this is a good sign. It's not going down yet, but it's at least flat, which I think indicates that our community is responding. They are acting in a more protective way, and that we are decreasing transmission such that we're at least flat at this stage in terms of those new admissions. This graph is showing three things. The blue is the hospitalization, so total hospital beds being utilized for COVID-19. The orange are ICU beds, and the gray are the ventilators being utilized. Yesterday we reported 602 hospitalizations with a moving average of 602. That included 10 individuals who are located in our alternate care site at the Austin Convention Center. That moving average of hospitalizations is a record high, and we are 97% above where we were a month ago in terms of hospitalizations. But again, it's starting to flatten out a bit in terms of total hospital beds being utilized. ICU numbers yesterday, 176 with a moving average of 183. That's up 101% in the last month. And we reached our record high in the moving average on Saturday. So again, it's not going up, it's flattening out a bit, which is a good sign as well. Our ventilator use, 106 yesterday with a moving average of 104. That's an increase of 112% from a month ago. And again, that measure also appears to be flattening out significantly. When we look at the jurisdictions impacted, so those that are above the 15% for 7 consecutive days in terms of hospitalizations for COVID-19, these jurisdictions around the state of Texas are still impacted. What we're seeing, though, in many of the metro jurisdictions is some flattening of the increase. Locally, the total hospital beds being utilized has been relatively flat, around 16 to 16.5% over the past several days. Other metro jurisdictions are similar. So again, it appears that there's a slowing statewide, which may put us in a better situation. Again, when we look at the total number of individuals hospitalized for COVID in our trauma service area, TSAO, it's about 22% of all the hospitalizations are for COVID-19 right now. But again, that number has been stable as well. When we look at the impact on our projections from the UT Modeling Consortium, we can see that there is a significant flattening for the projections for the admissions to the hospital. So again, this is variable. This is based upon the admissions as well as mobility data. Last week when I reported this, we were pointed in a significant upward direction and indication of potential for rapid increase in admissions to the hospital. Because of this flattening that we've been seeing in terms of admissions, the projections going forward through the middle of February are relatively flat. Again, they're not going down significantly and quickly, but this indicates to us if we continue those protections, if we continue to stay home when we can, to work virtually if we can, if we choose to go out, to wear a mask, distance, pay close attention to our hand hygiene, so washing our hands frequently, we can push this down even further like we did in the summer and hopefully put us in a better situation in terms of the ability to ease those restrictions as we move down in staging. No indication right now, at least in the middle of February, that we're going to be getting out of stage 5. But again, that could change if those protective measures continue and are enhanced. We see a similar pattern for the hospitalization, so the total hospital beds being utilized. Again, this projection shows a slight increase over the next couple of weeks leading into February and then some flattening. So again, much better circumstance than just a week ago in terms of the projections. We see similar projections for ICU care, again, getting close to that 200 mark and then riding that 200 level through the middle of February. So again, better news than I had last week, but similar to the other projections that I provided you over the past 11 months, this is dependent upon us as a community continuing the protective actions that are resulting in this decrease in hospitalizations. This is an update of our graph of hospitalizations based on age group. You can see from this graph that we've seen some increases in our 60 to 69 and 70 to 79 age group. We have seen a decrease in our 80 plus age group, and a slight increase in our 10 to 19 age group, which is the third line from the bottom, the gray line, again towards the bottom of the screen. When we look at the impact of numbers of individuals hospitalized, this is what we're seeing here. Overall, you can see last week we had a slight decrease in total hospitalizations, moving from 545 to 537. A slight decrease in the 80 plus age group in terms of hospitalizations, but slight increases in terms of the 60 to 69 and 70 to 79 age groups. You can see that we continue to have a significant number of individuals in the 20 to 29 age group and 10 to 19 age group, between them 43 admissions to the hospital. Again, this tells us that there is a significant disease transmission in those age groups in order to lead to this volume of hospitalizations. So again, this is while we're really concerned about protecting our older age groups, those 60 plus individuals, this disease can still impact younger people, and we all need to be careful and ensure that we're teaching our children, ensuring that our children are following those protections as well. This graph is showing the hospitalizations week over week based on race and ethnicity. When we look at the white non-Hispanic group, this is the blue line at the top. That represents 47% of the admissions to the hospital last week. 38.2% in our Latinx community, the green line. The gray line in the middle of the screen, our African American community, 10.7%. When we look at the numbers of individuals in each age group, or in each race and ethnicity, we see there has been a decrease since last week in our Latinx community, 195 to 182. Increase in our white non-Hispanic from 208 to 224. Slight decrease in our African American community, 59 to 51, and relatively steady in our Asian American community, 16 last week, 16 from 2 weeks ago, and 14 for last week. So this is a slide that makes me very happy. And what we're looking at here is our percent positivity week over week for the last 12 weeks or so. One thing I want to mention about this data is you can see that the positivity rates for most weeks have dropped slightly. This is because this data relies on testing feeds from particular testing entities. We added another one last week, which added 75,000 tests since May the 1st. So you can see that there has been a drop in the overall positivity as a result of that additional data. But what we see is that the data I presented last week, 16.2%, has dropped to 12.8% for last week. And this is with more than 20,000 test results in already for last week. So this is certainly a positive indication that things may be slowing significantly. Again, we have to continue this push. While 12.8% is better than last week, we want to get it below 5% and particularly below 3%. So we have more work to do, but the work that folks are doing, the sacrifices that people are making, the choice to do virtual education, virtual work is paying off. And again, we hope to see that continue over the following weeks. We'll look at the impact of positivity across races and ethnicities. That is this graph. Again, we see significant decreases in many of the races and ethnicities that I'm showing you. Our Latinx community in the gray bar in the middle of the cluster is 19.7% last week. So a significant decrease there. Our African American community, 12.3%, also significant decrease. The green bar is our American Indian and Alaskan Native. That group had a significant increase to 16.1%. Our Asian American community, 8.9%, and our white non-Hispanic, 10.4%. So again, certainly a better picture for many of our communities of color. For the data last week, we still have a long ways to go to push it below that red dotted line and the green dotted line representing 5% and 3% marks. When we look at the positivity based on age group, again, we can see that there has been decreases across the board in terms of the positivity. Unfortunately, the positivity is highest amongst those that are most likely to be severely impacted from COVID-19. So we can see that our 80-plus age group is leading positivity, 16%. Our 70 to 79 age group, 15.6%. So again, every age group over 40 is outpacing the community positivity. So again, we've got more work to do, and this is a reminder that we all as a community have a duty to protect those who are older in our community. And that means if you're going to visit or interact with individuals, particularly over the age of 60, you need to ensure that you are using distance, you are masking, you're washing your hands, and you're avoiding risk for exposure yourself. When we look at the positivity amongst our school age individuals, we can see that there has been a significant drop in the positivity rates. So high school students, high school age students, 17.9%, middle school, 15.6%, elementary, 11.7%, and preschool, 12%. Again, this is positivity amongst those tested. So this doesn't represent that 12% of preschools are infected. These are of the ones tested. But again, significant decreases. But once again, this week we see that our middle school and high school age students are outpacing the positivity in the rest of the community. This is an update of our long-term care facility cases, 225 in the last 14 days, 481 in the past 28 days. Again, this data is updated by facility on a weekly basis at our austintexas.gov/COVID-19 website for folks who want additional detail. Once again, the best way to protect our most vulnerable members of our community, our elderly, living in long-term care facilities, is to decrease positivity in the rest of the community. So again, from these numbers, it's clear that we have more work to do. 240 of our total deaths have been associated with these facilities. Once again, we remain in stage 5, which is our highest stage of risk. Just want to, as a reminder, remind folks that gatherings outside of the household are discouraged. People should avoid dining and shopping in person and limit those to essential trips as necessary. Avoid non-essential travel, and we're recommending our businesses continue to transition their space to contactless, takeaway, delivery, and drive-through as the primary options for that. Judge and Mayor, Commissioners, I want to talk about one other thing before I transition over to Director Hayden. This week, as many of you saw in the media, there was a discussion about my recommendation that our state legislators be vaccinated. So I want to touch on that a little bit and state that I continue with those recommendations. It's important to understand the whys behind that recommendation. So when we look at the CDC data and the modeling for how to roll out vaccination, there's some conflicting information. On one hand, if we focus on individuals over the age of 65 as our primary target for vaccinations, it decreases mortality 1 to 4%. If we focus on individuals who are more likely to spread disease, it decreases transmission by 1 to 5%. Now, this is why the CDC has rolled out the 1A through 1C, with the 1C being essential workers. So the decision regarding the legislature was for a couple of reasons. Number one, we have a unique event which is happening in our jurisdiction, in the city of Austin, in Travis County, and that is a legislative session which brings individuals from around the state of Texas to one place. We're talking about thousands of people who are going to be in contact for 6 months. And that represents a risk for a super spreading event. The other concern is for continuity of government. And we have to recognize that essential government services must continue, and that COVID-19 remains a threat to those essential government services. So I stand by those recommendations. My hope is the state will provide a specific allocation for that purpose. But as far as the city and county is concerned, we are going to focus some of our resources, a small amount of resources, focus on that continuity of government plan. We're going to primarily focus on the 1B group, but this will include elected officials, city and county. This will include our county and state judges who fall into that 1B category, as well as key staff who fall into that 1B category. We will continue that with other governmental services. And Director Hayden, I think, is going to touch on some of what we've already done, but perhaps some of what we see also being utilized, or that kind of government function, how we're going to utilize vaccine for that in the future. With that, I'll pass it over to Director Hayden.
Good morning, everyone. I have my name. My name is now
We've got a bad signal.
Stephanie Hayden Howard. And I know it'll be a transition. And so just please be patient as we transition. Can you hear me now?
You were breaking up.
Hello?
Hello?
Excuse me, Stephanie.
Yeah, we had a bad connection there. Director Hayden, can you try talking again?
Will it help with her bandwidth if she stops her video? Otherwise, the sound is not usable.
I think you're muted, Director Hayden.
Judge, I'll mention one other thing while Director Hayden gets reestablished. I want to mention that we're also expecting the AstraZeneca vaccine to receive an EUA, emergency use authorization, by the FDA around the end of the month. And there's some confusion and controversy about the AstraZeneca, so I want to touch on that quickly. I've heard from rumors from the community that it's less effective. And I want to say that we don't have the complete data set yet for AstraZeneca, but it's important to remember the AstraZeneca endpoints of the trial were different from the Moderna and Pfizer. So Moderna and Pfizer endpoints were if somebody developed symptoms and tested positive, that was counted as a case. So those two products are 90%, 95% effective at preventing symptomatic infection. The AstraZeneca product had a different process. So basically, they tested individuals on a regular basis to try to detect the presence of infection. So when the trials say they're 62% or 90% effective, that's 62% or 90% effective at preventing infection at all. So it's a different endpoint, and it actually may be a better endpoint in terms of the overall efficacy. So these are the things that we'll be looking for in the packet that they send to the FDA for the emergency use authorization. But it again, like the others, appears to be very promising, and it may eventually prove to be an even better vaccine.
Thank you, Dr. Escott. I don't see Director Hayden back on the screen yet. Do you?
I'm here.
Okay.
Good morning.
Yeah.
Can you hear me?
Yes, we can hear you. You wanna?
Okay, great. Okay, thank you for the opportunity. Next slide, please. We wanted to come this morning and kind of walk through some information about the vaccine. One of the things we want to share with you is that we know that we're going to need to reach approximately 70% of the Travis County would need to receive the 2 doses of the vaccine. What we know in comparison to H1N1, as well as our early on testing, the vaccine will come in very slow. And so we cannot overly emphasize that how the vaccine is going to come in will continue to be slow. And so when we worked on H1N1, we vaccinated about 30% of our population. And so our private providers, pharmacies, physician offices, etc., they provided vaccines to over 300,000 people, where Austin Public Health only provided vaccines to about 32,000 folks back then. We know now we have more providers that have registered with the Department of State Health Services. And so the plan is that when vaccines are coming regularly, we know that several of them have said that they have the ability to be a hub as well. And so I'm sure most of you have been hearing the language that Austin Public Health is a hub. And so basically needs to have the ability to provide large volumes of, and that you work with neighboring small counties to partner with
Mayor, this is Director Hayden. I can't understand you.
Color and older adults
Dr. Hayden,
for this vaccine process.
With your audio.
Yes.
Should we ask Director Hayden to try to speak without her video and see if it makes a difference?
Yeah.
Yes, try that. Sometimes that helps because it's not useful. It's hard to understand.
Stephanie? Stephanie? We're having trouble understanding you. Can you turn off your video? Did we lose Stephanie again?
Okay. Okay, turned it off. Can you hear me better?
Yes.
Yes.
Can you go back, please?
Good morning. Can you hear me now? I turned off my video. Can you hear me?
Yes, that's better.
Okay. Okay. And so appointments are recommended. Next slide.
Stephanie, can you go back? We missed the last several minutes of what you were doing.
About when you were talking
Okay.
about the hub, Stephanie, about the hub.
Okay, so essentially the definition of a hub is a provider that has the ability to vaccinate several people in a day. Also, you must be willing to work with other neighboring counties, smaller neighboring counties. So that's like Hayes and Bastrop. And potentially Williamson for us because we think about the MSA. And so that is the definition of a hub. And so other providers are definitely signing up to be a hub as well in Travis County. We know that as the best practice, we also need to make sure we have large scale distribution sites, but also make sure you have multiple small scale sites. And appointments are recommended, and we are only working off of appointments. Next slide. As you all know, we have been using the Austin Salesforce portal. That has been the portal we have used this entire time. And I understand that, several, folks are having some concerns with the portal itself. And so we have employed some coding and data folks. We are working with a new developer. But I think the other thing to keep in mind is that the potential use of anyone in Texas is a reality for us. And so we have over 166,000 accounts that have been created, and 60,000 of them qualify for the vaccine. And when we say qualify, we mean people that are 65 years of age and older, or 64 years of age and younger, with an existing underlying health condition and not have insurance. We are going to be putting together our demographic data that we will share on our website with the rest of our dashboards. One of the common things that we have been hearing is the password errors and the kind of the malfunction. What we have been putting out to the public as a solution, if you would, for your username, if your email is johndoe@hotmail, you would want to add .aph. And so, if folks are reaching out to you, we have put that out to the public. We'll continue to put that out to the public. But basically, they would not have to reset their password. They will only have to add APH to the end of their username, and they should be able to log in. Now, there's been confusion about appointments versus vaccines available. If there are no appointments, we don't have any other vaccine. We only release appointments when we have vaccines to accompany them. And so there's times like we did on yesterday, we released appointments, and within 2 hours, those appointments were gone. And so once appointments are out there, very quickly, because as you can see, we have 60,000 people that are eligible. And so they're going to quickly get those appointments. The other thing that we are working on is there's been a little level of confusion where folks have been going to testing and scheduling testing, and for them, they felt like they scheduled a vaccine appointment. And so our staff are working to make that more pronounced, so folks will not have any confusion. So that's one of the changes. And so we're going to be working with our communications folks so we can get the word out about these changes that are going to occur this week. But right now, if folks are having any problems, that APH, adding that .aph to the end of their name, that will work today. Slide 3.
Director Hayden, just a really quick comment. I've heard from people that the language that instructs them to add that .aph at the end doesn't show up in the error message, and they have to look in other places on the site. So if you're having people recode it, if it can be part of the instruction with the error message, that would help.
Okay, thank you. This is just an update on what Austin Public Health has received. We, as you all know, initially we received 1,300 vaccines, and then we received 12,000 on the 11th and on the 18th for this week. And by Saturday, we have provided 12,600 vaccines. We are prioritizing educational staff, folks that are working in public, private, and charter schools. We started that process yesterday, and we will continue that effort this week. And so the remaining doses will be distributed to the community this week. We are working with several partners. One, we are working on plans to be able to look at large-scale events in our community, and then working with a partner on that that does event planning. In addition to that, we have partners that are going to be making some calls for us to call everyone and provide some additional information, including the .aph at the end of your username. With the second dose, just as a reminder, you will need to go back to the provider that provided your initial dose. Now, with the event that was in Dove Springs, we will be reaching out to those patients, and so we will add them to the process of providing that second dose. The last thing is that we are rolling out our education process and outreach to be able to get additional information out to hard-to-reach populations. And so we have 8 vendors that we're in the process of finishing their contracts. And then from there, they will continue to assist us in all areas, especially education and outreach. Next slide. At this time, I'm going to transition over to Spencer Crump.
Thanks, Director Hayden. And I first want to recognize Director Hayden and Dr. Escott and the incredible work of our city and county staff. From the beginning, we've had great cooperation and coordination between the city and the county. And I also want to acknowledge the support and collaboration from all of you as our elected officials and from the numerous partners that we work with. But as you know, we have 1.3 million people in Travis County alone. And as Stephanie mentioned, vaccine providers would need to vaccinate 70% of the population with 2 doses of the vaccine to achieve our herd immunity. We are working to get these vaccines out as fast as we can. And last week, I'm proud to say that Austin Public Health, with our partners, provided all 12,000 doses that were given to us to be administered. But I want to remind everyone that just like the COVID-19 testing rollout, there were challenges in the beginning, and it was also a slow process. As we learn more information from the federal and state level, we've made changes and improvements, but this vaccine was only approved a month ago. And it is our understanding that as additional vaccine will trickle in for the next few months, we will continue to ramp up our efforts. But it's critical that we manage expectations, both with our community and our important partners. As Stephanie said, we have to prioritize the vaccine for people that are over 65 and people from racial and ethnic minority groups. But we're committed to continue this work to keep our community safe. We ask for your patience and continued support during this entire process. And with that, Mayor and Judge, we will turn it back to you for questions from the group. I think the Judge was going first. Judge?
Thank you. I'm going to turn it over to Commissioner Gomez, and then I'll call on the rest of the commissioners after that.
The question that I have is based on the questions that I get from the public. Since we keep saying throughout the presentations that we've had on these graphs that we're prioritizing people over 65, the 1A, the 1B, and now we've added 1C. But it appears to folks that we kind of get off that priority list. Are we really sticking to it, or are we kind of, going back and forth? Because it really confuses people.
I'm certainly happy to start, and Director Hayden may want to jump in. The vast majority of vaccine is going to 1A and 1B groups. Again, we have the circumstance of the need to ensure our continuity of governmental operations. So we are focusing some of the resources on people like teachers. When we look at my recommendation for the legislature, that was not APH vaccine that was utilized. Again, we've recommended that the state allocate resources for that particular purpose. But, we're going to have circumstances through, providers. Again, we've got 350 providers providing vaccine in Travis County that have signed up for it. There are going to be others who fall outside that group. And generally that happens because once you thaw the vaccine and you've pulled it up in syringes, you've got to use it in a short period of time. So what we've seen is that, there are circumstances where providers have extra. They've gotten through their doses that were scheduled. They've identified additional doses available in the vial. Moderna generally has 10 doses. In our vaccination of teachers yesterday, many of those vials had 11. Some had 12 doses. So sometimes at the end of the day, you've got extras, and it's a priority to get those out as quickly as possible. APH has additional people that we can call who fall within that 1B group. Others may not have that. So they're scurrying to ensure that it gets in arms instead of being wasted. But I do have confidence that the vast majority of vaccine in our community is going to 1A and 1B.
Okay.
Thank you. Commissioner Shea?
Thanks, Judge. And as usual, thanks to Dr. Escott and Director Hayden. I have a couple questions. Do we know how many total doses are being sent to the community? Previously, we've heard something like 350 providers were getting scattered allotments. But do we know how many total doses are being sent to the community? And is the state continuing, this really inefficient and frankly broken process of scattering doses among private providers who don't have the capacity for signups, who don't even have good phone systems? I think we've all heard stories of dozens and dozens or more of people calling through all the lists of the providers that are on the state map, and frequently can't even get through on the phone. And once they do, they're told, no, either that's only for our current patients or call HEB. So is the state still doing that? And if they are, can we just agree as a combined body to request that the state simply send a unified allotment to a hub, which I assume we could create fairly easily with Bastrop and Hayes? Sounds like Williamson's already forming a hub. But there's got to be a more efficient way to do this than what the state has been doing. So are they still sending these scattered allotments all over the 350 providers, or have they changed that process? And if so, when will we expect to see more? And my second question has to do with any indication we're getting from the, thank goodness, new administration in Washington, where Biden has announced a plan to have 100 million vaccines in the first 100 days. So presumably that would change our calculation on how many doses we expect to receive. So those are my two general questions.
So Commissioner, I'll start by saying, I think the state is working hard to pivot, and we've seen that happen. The initial allocation was to hospitals and a lot of different groups, and they've really focused their efforts now on these hubs. As Director Hayden said, it's not just one hub, but multiple hubs. So groups that can do 1,000 or 2,000 vaccines a day. We've seen an allocation to Williamson County. We've seen allocation to Hayes County. So I like what the state is doing now in terms of focusing the majority of vaccine on those hubs. So I think the plan right now really is to get out large volumes quickly so that the hubs make sense. But as we get through those large numbers, they are going to probably need to transition back to smaller places that people have easier access to, places that they normally go for their vaccine. So I think that we're going to see some shifting in allocations as we go into the spring. But I think they're doing a good job now of refocusing the efforts on the hubs. Our hope is that we can increase the volume of vaccine available. As Director Hayden said, we've got multiple entities capable of doing thousands a day. Our partners at HEB have great infrastructure and emergency management processes. They could do thousands a day. Austin Regional Clinic, thousands a day. Others, CVS, Walgreens, and other places. UT Dell Medical School has done a great job of large volume allocations. So again, our hope is that we can have multiple large hubs in Travis County and around Travis County to start to get through high volumes of folks.
Thank you. Commissioner Trevelyan?
Thank you for the work that's been done, Dr. Escott, and also Director Hayden. We appreciate the commitment that you've shown to work with us. My question really piggybacks on something that you just said, Dr. Escott. It seems to me that the primary infrastructure for providing shots and providing hubs is kind of the affluent part of town. So my question is, what specifically are we doing to make sure that those parts of town that have not been invested in economically, but have other hubs like schools, for example, like community centers, like churches, for example, what specific plans are we putting in place to make sure that the parts of town that do not have a solid economic infrastructure will actually see opportunities for vaccines as well, because there are a lot of our Title I schools that are serving not only teachers but students in that area. Hopefully we'll be looking at retirees and people who are on forms of public assistance as well, so that all of the hubs are not in the affluent part of town, and all of the less affluent parts of town won't have immediate ready access. What are we doing to develop specific plans and using resources like the Expo Center and churches and other entities, public entities that exist in those areas?
One of the things that we have done is we have identified several locations in the Eastern Crescent that have the ability for us to either have a long-time presence at that location and or that has the ability for us to set up how we've done in the past with flu vaccines. And so making sure that as we look at the data and look at specific zip codes where we know we have more people of color and we have more folks that really need that access in their community. And so that is a part of our plan, and we've identified several of those. But one of the things is, is definitely key is that, knowing the vaccine is coming in and that we can count on it, because we don't want to set up a facility and open it up and we don't have a vaccine to provide. So those relationships have been established, and we will continue to work with the various partners, whether it's the specific schools, the Title I schools, and faith-based churches, etc.
We're prepared to work with you and help you reach into those communities. Just reach out to us, and we will share our network with you.
And Commissioner Trevino, I just want to add on. I think we're gonna see a shift in how we approach it as we move into the spring. Again, the issues for January and February are going to be prioritization and getting it out to folks who need it the most, getting it out to our essential workers. March, April, May, it's going to be a different challenge. The challenge then is going to be getting more people to want and sign up for the vaccine. I'm pleased with the fact that we've got more than 160,000 signed up, but we need to vaccinate, 800, 900,000. So again, our challenges are going to shift as we go into the spring. And that's why we need to continue this effort, continue the advocacy, continue the discussion regarding the importance of vaccine, particularly for our communities of color that have been so disproportionately impacted. We expect that those communities will be more challenged to get vaccine into arms. So Director Hayden and her team has done a great job of pre-planning, messaging, and talking about how we're going to adjust strategy based upon the expected shift in those challenges.
Thank you.
Thank you.
Thank you. Commissioner Howard?
Thank you. Good morning. My question deals with messaging, and I wanted to briefly welcome Stephanie Hayden Howard to the Howard clan, and note that the message she sent to us is that she has a new last name, and I'm just delighted that she's adding Howard to her name. Second, some of us got a letter from our healthcare provider, like Austin Regional Clinic, that they no longer had vaccines and that we should look to Austin Public Health. And so could you clarify the message to the community about the priority with the vaccines that we have at Austin Public Health, that they are still for folks who don't have access otherwise or won't have access otherwise, or who are uninsured, if that is still the case?
Yes, Commissioner. That is still the case. We are targeting 65-year-old folks, 65 years or older. You can have insurance. That's not a problem for you to have insurance at that age. What we are targeting, though, is people that are under 65, so 64 years and older, that all of them still fall into 1B, and that they don't have insurance. I think it's unfortunate that providers have sent that type of communication forward because all of the providers, we did share with them our target population. And so we can follow up with them and really try to do some joint messaging, because I think that would be beneficial for us just to work together.
Thank you.
All right, so I've got a question here, then we'll pass it after this to the City Council and the Mayor. Director Hayden, and Dr. Escott, we know obviously the biggest barrier to getting the vaccine is that we just don't have enough in our community. But at the same time, as Commissioner Shea pointed out, Biden has stated that, you know, his goal is to get 100 million in 100 days. So we do need to be ready for that if that does happen. I want to thank you, especially Director Hayden, for all the work that you're doing to meet the incredibly important need of getting vaccines into the folks who are at greatest risk in our community. But I'm hearing from the community that they understand this generally, but they want some transparency around how the vaccine is getting out, how are we distributing it, and some reassurance that we have the ability to mass vaccinate when that time comes. And for me, I think we can do this by creating a website that works, that provides good, easily understandable information, and holds us all accountable to the public. And so I've asked county staff to work with you and the city staff to stand up a website, and I've seen a prototype of it. I think it looks good and will be helpful. But I'd like that website to provide a central site to access any vaccine providers in the region for both insured and uninsured people, to allow people to sign up to volunteer, because I know from having run a small pilot drive-through vaccination clinic with Constable Morales and others, to seeing the Delco Center, more volunteers that have skills that we need will help. And I'd like the website to show how many vaccines have been given out and where and to whom they are going. We have some of the most advanced technology companies in the world, and I know I've talked to Mayor Adler about this. He's willing to connect us to those folks. And as Commissioner Trevelyan said, the entire court, all of us here in the Commissioner's Court, we're committed to doing whatever we can to support your efforts, either with our county team or trying to engage the private sector along with the mayor to support these efforts. So these are some of the things that we can do to help the community know what we're doing and help inform decisions if we need to change tactics or to get the vaccine out faster or more equitably. And so I'd like to know what is the biggest barrier to APH to setting up this website along with the county that would accomplish these goals? And could you report to us through this website who is receiving the vaccine and where do they live? And how quickly do you think we could bring some transparency to these efforts? And again, if there's any barriers or challenges to this, I know Commissioner Howard, everybody here is willing to work to remove any barriers that we can and help do that. But also, again, I want to thank you and Dr. Escott and all the team that got out those 12,000 vaccines last week as you set your goal to do. Want to greatly thank you for your efforts.
So, Judge Brown, as you know, your team is working with the city's team on that platform. And so, we'll continue to work with your team on that platform. I don't have, any concerns about us being able to get that platform done at this time. But I will just say that we do need the additional time. We were able to, our goal every week is all of the vaccines that come into our community is to be able to get the vaccines out the door within a 5 to 6 day time period. That is our first goal. And so, yes, we are willing to work with your team, do whatever, we do need to do to set up that portal and provide that information. We have typically kept all of the information, kind of an Austin Travis County type site with dashboards. And so my request is that we continue to centralize whatever kind of efforts that we stand up and that they're not in multiple places. Is my recommendation.
Sounds good. Thank you. And with that, Mayor, I will pass it over to you to call on the city council members in your order. I think you're muted, Mayor Adler.
I was, thank you.
Okay. Yeah.
Judge Brown, thank you. We'll now work our way through the city council. Council Member Ellis. And each of us ask one question, and then we'll pass it on to the next person.
Thank you. I appreciate that. I've heard a couple of different varying questions I'll try to put into one question about the newer strain of the virus. And I may have connectivity issues, so I'm going to turn my video off. But just general questions about what do we know about its transmission, its contagion, is a new vaccine being developed? Is it affecting younger people more than older people? Can you go into a little more detail about what is and is not known about this other strain at this point in time?
Certainly, Councilmember. The indications that we have right now are that it is significantly more contagious than the main variant. We don't have a lot of surveillance detail, particularly in the state of Texas, in terms of doing genomic sequencing of viral cases. There is efforts via the federal government to increase that genomic surveillance so we can have better intelligence on when the variant changes. The good news is that there's no indication that it's more deadly. The bad news is that generally more contagious is worse than more deadly because it has the ability to infect more people. Again, I think the take-home point for our community is we have to protect ourselves. We have to stay home if we can. We have to choose virtual education if we can. And if we have to go out, we must wear a mask, we must distance. Those same protections will work. But it's going to become increasingly difficult to protect ourselves in those places where we may be able to protect ourselves in the past.
Okay, Councilmember Kitchen.
Thank you.
I think this is for Director Hayden. I believe that I heard you mention that there would be some outreach efforts, and I'm not sure if I caught everything, that there would be some efforts to call everyone. And so my specific question is a little bit more detail on outreach to the extent that you know at this point. I think I heard you say you're still working it out. I'm particularly trying to understand the seniors who live in the community, particularly elderly folks. I'm wondering if y'all are working towards outreach that might include phone calls or postcards or something, because I'm concerned that those are the individuals, that those, among other individuals, will have difficulty with the electronic process, and also are, we've shared concerns that some of them are having difficulty with getting through on the nurse hotline. So can you just tell me what your plans are? I know it takes a while to get everything in place, but could you let us know for actual proactive outreach to seniors in the community who are living at home?
Yes, the process is not fully developed, but it will target individuals that are 65 years of age and older. Those are the individuals that will receive a call from an individual, and they will be able to answer any questions that they have. So once we have that developed, we'll send communication out to council and commissioners court about that process.
Thank you. Do you have a timeline at this point that you can share, understanding that you're still working through it?
I think we lost Stephanie. Let's see if she comes back.
Can you hear me?
Yeah, you're back now.
Okay. We will have an update by the end of the week.
Thank you.
Councilmember Harper Madison.
Thank you, Mayor Adler. Thank you, Director Hayden Howard and Dr. Escott. Good morning, everybody. My question is about, I guess, in alignment with Councilmember Kitchens about outreach. In which case, so I'll sort of wait for that end of week update for that part of it. But, you know, some of the specifics are the who, the when, the where, and how we're reaching them. And that gets me to the primary point of my question, which is what I'm reading says that people of color are not being vaccinated at the same rate as Anglo-Americans. And I want to know what that's about. Why? I mean, is it exclusively outreach? Is it related to Judge Brown's point about a comprehensive website? Is it related to Commissioner Trevillion's point about, you know, getting really granular in neighborhoods and accessing fire stations and schools and religious organizations? I mean, I'm trying to figure out why folks aren't getting vaccinated, and I'll just sort of put on the tail end of that, you know, my anecdotal experience, having seen the lines at the Delco Center, just a visual observation was, you know, that there were a fraction at best of people of color in the line. The singular unifying similarity was age. And so I'm also curious if the Delco Center, plopped right in the middle of Northeast Austin, seems relatively accessible. Why weren't more people of color in that line? So that's, you know, it seems like a complex enough question that you may not be able to give me a complete answer today, but I'm very curious about that and want to know what we can do both at the city and the county to support the efforts to make sure more at-risk populations of folks are being vaccinated.
What we are finding is that because the system has not been as user-friendly, we know that most populations of color are not going to continue to come to a computer and try to access that. And so what we have put in place is, and we're continuing to work out the details, is that we are going to be working with some partners to ensure specific outreach to target populations. And be able to make sure that those target populations are able to get those appointments scheduled. Because Salesforce was not, had a lot of technical issues, thousands of folks were calling our nurse line. And so the nurse line was set up not to provide technical assistance, but the nurse line was set up for folks that did not have access to the internet. And so we will be working with some partners, being more intentional. We'll continue to leave, you know, the nurse line set up the way it is. Our hope is if we work out, you know, the majority of the problems with the site, we can free up that area and it can work as it's intended to work. So in the meantime, our staff will be working with our outreach partners to identify clients that we can start to provide the vaccinations to this week.
Thank you, Director Hayden Howard. I wonder if in that update that we get at the end of the week, we could get a clearer picture of who our outreach partners are. That way each of us can take the opportunity to introduce names that may not be on that list that are specific to our districts.
Yes, that will be fine.
Thank you. I appreciate it.
Mayor, you muted.
You're muted.
Okay, Councilor Fuentes, and I apologize, colleagues, I didn't go in district order, and I'm catching up there now. Councilor Fuentes.
Thank you, Mayor. First I want to reiterate, or I want to emphasize what County Judge Brown mentioned about having a comprehensive integrated website. We are the tech city of our state, and we should be leading on this issue. And so I really hope that we can work together quickly in offering that service. But also, in light of the conversation that Councilmember Harper Madison brought to light, many in our communities of color are relying on phone calls. And so if there's a way that we can scale up that operation to handle the immense call volume of calls that we're getting, I would love to see that, because that is I know for my office, we are directing people, they actually want to call someone. And for my generation, we have individuals who are calling on behalf of their parents too. And so we just got to figure out a way where we can, have that integrated, comprehensive website, but also acknowledge that we need to get the call system operationalized as quickly as possible to help our communities of color, especially our elderly. So my question is about the drive-through vaccination. So it's my understanding that currently APH is not doing any drive-through vaccination sites. Are there plans to do that? As we think proactively, if the Biden administration is able to offer 100 million vaccines in the next 100 days, will we move to a drive-through vaccination model? And I appreciate APH's that you outlined in your memo about allowing folks to wait in their car, not having to wait in line for their time. And I hope folks know that out there, that there is a process out there that you can wait in your car as you're awaiting your appointment schedule. But I would like to see drive-through vaccination sites throughout our community. And also, just a side note, in my district, we have a veterans clinic that has very large parking lots, and it's in the 4-4 zip code. It would be a great site for a vaccination drive-through site in coordination with our federal partners. Thank you.
Yes, right now we are not offering drive-through sites. However, our team are working on plans for those. And so we will keep you all posted once we transition to that type model. We know we will need to continue to do both because we want to make sure that we are maximizing with the vaccine. Currently, with the drive-through models, we have to make sure that we can set it up in a process to where we can at least be able to provide vaccines to at least 200 to 300 people per hour. And so those sites will need to be set up to allow that type of throughput.
Thank you. Councilor Renteria, do you have any questions?
Yes. One of my questions is that, we do have a VA clinic out there, and is the health department working with them? I know that my wife is a veteran, and she hadn't got any notification whether they're going to have vaccine anytime soon. Have you heard anything are they going to have vaccines that they're going to administer over there on that location? My understanding right now is only Temple and some of the larger sites in Dallas and Houston area are administering those vaccines.
I have not seen the VA here in Austin on the site. And so we would have to coordinate with them as well as dishes to determine if that is a site that they've identified. So we can let you know about those conversations.
And Stephanie, one of the confusion is the state dashboard where they show the locations of people that have the vaccine. My understanding is that you shouldn't be calling those sites because you're basically public health is coordinating everything. I wonder if you could just get that message out, because I'm sure that a lot of these locations are getting called right now, and it's probably tying up their staff to answer some of these calls. So, and I know that since your guys are coordinating everything, that they shouldn't be calling these locations because they're not going to be able to administer any of those vaccine shots to the public.
Okay, thank you. Councilmember Kassar.
I want to thank Councilmember Fuentes and Judge Brown for bringing up really getting our operations ready for potentially administering so many more tens of thousands of vaccines in a comprehensive way. So I just want to echo that point. But my question goes a little bit more to what Councilmember Renteria just said at the end of his comments. There are so many people who are getting different messages from their private providers, from the state, from what they hear intermittently from the city, that I think it would be so helpful if week to week, as we get a shipment of vaccines, if we were able to have in writing for people, if you fall into this category, this is what we recommend you do. If you fall into this category, this is what we recommend you do. And we know that's shifting from week to week, but I would find that so helpful so that we could say, if you're under 65 and you have an underlying condition, but you are insured, then do the following. And even if it says that all we can recommend you do is wait, or try calling some private providers, but they may not have any, that can be hard to tell people, but it would be really useful to have a transparent place where people just hear the truth the best that we can deliver it. And I think we discussed this a little bit at our last meeting, so I'm interested in whether we've developed something like that and I just haven't seen it, if we're planning on developing something like that, or if y'all don't think that's a good idea, and here's why. But we just get calls from people in different categories who want to do the right thing and are willing to wait, but they don't know whether they're supposed to wait or sign up with APH or call HEB or what they're supposed to do. And they get different information.
I think one of the challenges of putting together something like that, because things do change quite often. In the past, when we told in our communications, when we said to contact your primary care provider or your pharmacist, etc., then all of them everybody just kind of starts reaching out, and then all of their phone lines are overloaded. And so now, they are directing people back to Austin Public Health. So I think the bottom line is that, everyone really needs to have patience. And so if that's the message that we need to put up everywhere for people to have patience, we really need people to have patience. I understand that the various systems are trying to set up something, whether it's HEB or Austin Regional, whoever the provider is. I know they're trying to put up information. But for us, right now, we're going to continue to be a safety net provider. And so that has not changed for us. That's always been our mission. And so I understand that is confusing because we're getting conflicting messages from everywhere else. And so that's kind of my recommendation at this point.
Thank you. And I just would ask that we put something together for folks that sets their expectation. And it may not say call your private provider. It may say you may call your private provider, but they may not have enough. And we're just letting you know. But if we don't fill that void, then the void of information gets filled with conflicting messages that could be even more confusing. So my ask would be that we try to put something together every week that gives people the truth, even if the truth might be you can try some of these things, but you may just not be far enough ahead in the line at this point.
Okay. Thank you. I think at this point, And you've had a chance to ask a question, didn't you? Okay, so Councilmember Kelly.
Thank you very much, and thank you, Dr. Escott and Director Hayden, for your time today. My question is about directing individuals in my district where to sign up for the vaccine. As you might be aware, District 6 is the only one that covers both Williamson and Travis County. And so for our Williamson County residents, do you think that you could provide some clarity on them utilizing the resources of the Williamson County Health District instead of APH? Or if you have any insight on that, if you could offer it, that would be helpful. Thank you.
Yes, council member, they can actually sign up whether it is with Austin Public Health or with Williamson County. They can sign up in any portal. It doesn't matter where you live. And so I would encourage them to, to sign up in both places. We have been providing vaccines to folks that are not from Travis County thus far because they access our portal. So encourage them to do both.
Okay. Councilmember Tovo, do you have a question?
Yes, I do. Thank you. I have about 90, so I'm going to try to merge a few of them into one.
Pick your best one, and you get your microphone.
Yeah, fine. A little closer. Thanks. Well, thank you very much to Director Hayden Howard and Dr. Escott for your tremendous work and the work of your staff and your responsiveness in working through some of the challenges that are being experienced. So all of us, I know, are receiving emails from lots of constituents experiencing website errors or other kinds of questions. And Manager, I'll just say en route to my question that it would be helpful if we knew exactly which staff members to contact with that. For example, that .aph issue, I think could have solved the problem, and I think will solve the problem for lots of our constituents. I've sent it off. I got 2 emails today just in the time we've been here that I think that problem, that will solve. And I only found out about it really through Neighborhood Next Door as a potential fix over the weekend. So if we knew exactly, I think that we can be of real resource to your staff in forwarding to you some of the questions and some of the experiences our constituents are having to help refine that messaging and refine some of the website challenges if we knew exactly which staff members to contact in either of those categories. So that would be helpful. I think, Director Hayden Howard, I would like for you to go back to the question of the hub. I am still getting questions about whether APH is the hub, and I'm not sure what the correct answer is to that. As you move forward with the kind of website that Judge Brown mentioned, can you help me understand whether that is going to have registration information available for sources other than Austin Public Health, or is going to be a registration system and information, unified information, basically for APH's registration? I know last week when we talked about it, you indicated that it was really challenging because different healthcare providers and different distributors have different systems. It's really hard to work all of that information into one online community portal. So that's a couple questions, but I think they're all related to, is APH actually our community hub? Or is it transitioning to that? How does that relate to its mission to be a safety net provider? And as you work toward that website, to what extent will it provide information about resources other than APH? What is the status of those conversations with other providers in our community?
Okay. Essentially, we are a hub, but we're not a hub in the way that people are thinking of a hub. We will not transfer vaccine from Austin Public Health to another provider in that sense. So all of the vaccine will not come to Austin Public Health. So I have to be clear that, as this process moves along, a hub in definition is a provider that has the ability to provide vaccines at a high volume. That's essentially the definition of what the Texas Department of State Health Services definition is. And so right now we are a hub. And as you know, most of you may have heard, yesterday Hayes County set up their hub, Williamson County has set up their hub, and so they're at a position where they can provide multiple vaccines a day in a short amount of time. And so the second question about the website, right now, what we would have on that website initially is Austin Public Health's portal. And so, as things change and vaccine is widely available, and this is kind of, what typically happens when there's more vaccine available, it moves to a place of making sure you're getting the shots in arms. And so that is essentially what most providers are going to do is make sure that they can get as many people the vaccine when it's widely available. So I hope that answers your question.
Councilmember, I'll add on to that. Again, as Stephanie said, we're a hub, not the hub. And I think there's been some confusion. It's a hubs model, not a hub model. So our hope is that we can, as other hubs develop, we can build some dedicated data feeds like we did with testing, so that we can not only have the APH demographic information and zip code information, but from multiple sources. We're also expecting that the state will provide access to our MTrack2 data. So this is where all the reports go from all the providers to the state for the purpose of that vaccine tracking. We're not sure what that looks like or the timeline for getting access to that, but that may provide us an even larger data set to tell us how we're doing on vaccinations by demographic and by zip code. The challenge, of course, is that data is going to lag behind our data. So I think the future is going to show a couple of different data streams to provide information on these items.
And so I think, just to clarify, I think the answer to the question of data coming from other sources and vaccine opportunities through other sources would be a priority for Austin Public Health to have available in a central system, but it is going to take some more time because but you are working with those other providers who might have vaccine and thus data to try to meld it into the Austin Public Health site eventually. Would you say that's accurate, Dr. Escott? But there is an interest in providing a one-stop portal that would include not just APH's sources and data, but also that of other significant distributor vaccine providers in the community. We're just not at a place yet where that's either possible or maybe relevant in terms of them having enough vaccine to have that info.
Yes, I think it's more likely that we'll see other public partners feeding in data into that the APH vaccine data stream, because it has a potential to utilize the same Salesforce platform, similar to what we did with testing in those data feeds. The data reporting component is one of the biggest rate limiting steps of the vaccination process right now. So in talking to our providers, they said, please don't require us to report redundant data to you locally, because we're already struggling with getting the data in a timely fashion so that we can get folks through. For the larger data piece, we'll rely on that MTrack2 data, which will lag a little bit, but will still give us a better and more comprehensive overall picture of the vaccination effort.
Thank you. Councilmember Alter.
Good morning. To first reiterate what Councilmember Kassar had said, which followed on our conversation from last week about the potential value of some kind of decision tree so that people know what their options are. Again, even if it is changing something is better than nothing, or even for us, because we're getting so many questions from people, to be able to direct them. The issue, for instance, with insurance has been rather confusing to follow. I think I understand now where we've landed, whereas if you're in the 1B or 1A and you have insurance, you can still go to APH, and that they're not providers that have sufficient vaccines. So that's where we're directing people to go who fall in those decision tree. The question that I want to ask, though, is not about sort of the vaccines, is about, we are now about 3 weeks out from New Year's. What do we know about the spreader causes, or from contact tracing, about, what is leading to the spread, so that people understand the consequences of their activities and the choices that they're making? I think it's always helpful for us to know, from the cases that the source of the spread. I think that would be for Dr. Escott.
So, Councilman, we're still seeing a lot of transmission that has traced back to the holidays. But again, beyond that, beyond the holiday spread, still a great deal of social gatherings with individuals. Still seeing spread in the school environment in terms of extracurricular activities. So, it's the challenge is that if there's a circumstance where people are in close proximity without masks on, that's where it's spreading. We're really not seeing, a lot of spread in circumstances where the masks and the distancing are in place. So, I think the flattening that we're seeing now, I think has, given us some evidence that perhaps the intervention that the mayor and the judge did at New Year's had some impact. And we're hopeful that that impact will continue. Our hope is that people will continue those protective actions. It's not really, as much about a particular place where transmission is happening. It's a set of circumstances where transmission is happening. So if we keep our physical distancing, keep our masking, we're going to continue to drive down that positivity rate.
Okay, thank you. First, I want to congratulate Director Hayden, especially with respect to getting the 12,000 out a week ago, and for being on track and getting the 12,000 out this week. That was one of the chief metrics to make sure that we would continue to get supply this way. And I think you've proven out kind of the concept of using the public health authorities. And I know there's a push at the local level, statewide, to do that, and then also nationally among cities and counties. There's also my understanding that over 1,000 people of the first 12,000 registered by calling. And I think that's an important number for the community to know, that was a really viable way to be placed in the system, and it was something that we used. I'd second the comments that came from Judge Brown. It'd be great to have a central system, but it's my understanding that the central system gets a little bit harder, especially as you tie it into scheduling, because the drugstores and the grocery stores and the hospitals all have their own separate scheduling systems, and they don't merge with one another. And there are HIPAA problems whenever we start trying to reach outside of Austin Public Health and try and get a partner to work with us in a real-time and active way. But I do like continuing to push to get the data in, which is what we did on testing. We didn't schedule their tests, but at some point we were able to order them to give us the data, so that the data we had was more robust and more timely than what we got from the state. I really appreciate the tech fix on the password user issue. I mean, that was probably 80% of the calls we were getting. But I reiterate what I think Kathy said about getting us a notice on that. I spent 45 minutes yesterday with a constituent trying to work through that issue, as so many people in the community were. And having learned today about that fix, we've gotten it out, and so far, everybody is now emailing back and saying it works. So great fix to that, and we need to really make that a really big thing for people to have seen, because it seems to work so well, and it was hanging up so many people. My question goes to the issue of demographics and who it is that's actually getting the vaccine. My understanding is that when we get the vaccine as a hub to distribute and we set up our registration system, anybody, not only anybody anywhere in our county can register. We just can't say certain people in our county are the only ones to register. Not only that, anyone outside of our county can register. So somebody from El Paso is allowed to go into our registration site, get an appointment, and then fly into Austin to take advantage of our delivery, and those are just the state's rules. But within that universe, when people register, you're asking health questions, you're asking demographic questions. Are you scoring or weighting the people that come in based on age and ethnicity and vulnerability and susceptibility, and then using that kind of weighting or scoring to figure out who it is that actually gets the vaccine appointment to be able to do that? And then associated with that, while we don't have any of the data for any of the other providers for the reasons that Dr. Escott explained, we do have our own data. And you said that you were going to post our data so that we could see within our operation who is getting it by age and by race and ethnicity, because that information will enable us to see either we're hitting the marks we want to hit, or if we're not hitting the marks, it'll point us to areas that we need to figure out different systems. So the question about ethnicity, first one, do we weight or based on ethnicity conditions when we're setting appointments? And second, when will we be able to see, when do you think you'll be able to post that initial demographic information so we can see who our tests have been going to?
So I'll answer the last question first and kind of proceed backward. Staff are putting together a report that we will be able to, the goal is to be able to, the folks that have come through the system, not the first day, Monday, Tuesday, but the first closed pod days when we were not on in Salesforce, it will not include that. So it will be a smaller subset of folks that have come through Salesforce. Our folks are putting together a report that we will be able to issue on Friday with the other document about outreach. And so the second question is that, yes, it's similar to what we did for the testing platform, when we are trying to get a target population. And so we have folks that have registered, they have an account, and so we have folks that are eligible, and we have folks that are not eligible. And so we are pulling from the folks that are eligible, and those are the ones that can sign up for appointments.
So the system kind of self-corrects. Anybody can go on the system anywhere. People that have insurance can go on the system because this is really the only system to go on now. But when we're actually giving the appointments, we take a look at the susceptibility and vulnerability factors for actually scheduling people. And that's the part of the system that we need to fine tune and make sure it's working well, to make sure that we're getting it out to the people that are most susceptible and vulnerable. All right?
Yes.
Okay. Judge Brown, I think that's, we've run through the council members. Everybody's had a chance to ask one question yet. Did you want to do a second round of questions, Judge Brown?
Yeah, I think we've shockingly gotten through this quicker than anticipated. So yeah, I think we'll do maybe a speed round of sorts, and I'll just go back and call through my list and then pass it back over to you if that is okay.
That works.
All right, so Commissioner Gomez, do you have a another question?
No, Judge, I don't.
Okay, thank you. Commissioner Shea?
Yeah, I did have a question, particularly about having a unified site. And I understand what Mayor Adler was saying about the difficulty of linking so that all of the scheduling at each of the private providers is included. But if we can just have one site that provides a link to the other hubs, the frustration I'm sure we're all hearing is people are calling through the 350 providers and it's chaos. So if we can have in this a unified site, and I appreciate the coordination to try and create it, if we can just have the 4 or 5 hub providers that you listed, starting with City of Austin, then HEB, ARC, CVS, Walgreens, maybe UT Dell, if we can just have on one site the hub providers, and then people can link to them, go to their own pages, and make the arrangements, that would at least provide some level of coordination. There's just enormous frustration and frankly, kind of chaos and confusion around this. So if we are creating a unified site, I would beg that we just list the main hub providers that people can reach. Because sending them to this DSHS list has been just nightmarishly frustrating for people. Is that part of what we're working on, Judge?
Yes, I think you laid out the general concept, yes. And I don't know if Director Hayden or Dr. Escott, if you have any.
Yeah, Commissioner, I think that's an excellent idea. That's the low-hanging fruit in terms of coordinating the process. The challenge we have is all the other hubs that I just mentioned don't have vaccine this week. So part of the other process is trying to integrate the weekly data on who's likely to have vaccine this week or not. I do want to be very clear. For individuals who are outside the 1B group, there's not any significant chance of getting vaccine for the next couple of weeks at least. People over the age of 65 or older, you need to sign up. You need to get on a list. Even if there's not vaccine today, there may be vaccine tomorrow or next week. And you're the group that we want to focus on right now because of that impact on mortality, severity of illness. For people who are 64 or under, it's probably going to be longer for most of them. There are going to be some exceptions. So again, teachers who fall in that 16 to 64 group with underlying health conditions may get it sooner than the general population because of that continuity of government services need. But generally speaking, right now, for the next couple of weeks at least, the real focus for most providers is going to be that 65 plus group.
Thank you. Commissioner Trevelyan.
Okay, just to piggyback on what's been said already, I want to make sure that we are tracking things that we can and should know. I want to know which providers have access to vaccines by zip code area, if I could. I want to make sure that we are also tracking the zip code areas of the people who have had access to shots, and then maybe we can also track the zip code areas of people who have registered to get access to shots. I think that if we have the capacity to know where the vaccine is, who is being served, and maybe some of the service isn't happening because people are not registering for it. Those are all important things that I think that we should know, and will give us some insight into the type of outreach we need to make to our communities.
I'll make a point.
Okay. Thank you, Commissioner. Director Hayden or Dr. Escott, do you have any thoughts there?
Commissioner, completely agree with you. And that's exactly the kind of information we intend to have, similar to what we've done for testing. That's the kind of detail that we want to have. It's going to take a little time for us to build that, to ensure the data streams are efficient and that we're getting enough data to populate that. We're hopeful to be able to access that data directly from M-Track2, which will give us more comprehensive data to populate those dashboards, but absolutely those are in the plans.
Thank you.
Commissioner Howard?
I'd like to go back to what Councilmember Kassar talked about with some shared messaging. I wonder if our two PIO departments could craft some, tweets or Facebook posts that we could all post and be sending out the same information. Much of what Dr. Escott and Director Hayden Howard have said, if we could just synthesize it and all share it, then at least we're doing our part to spread the truth. And I'd be, interested in trying to help with that if there's a way to make that happen.
Thank you. Okay, so two things. One, to Commissioner Shea and the mayor's point about the website. Yeah, I think in general, and I've got to give some credit here to Matt Largy with KUT. He actually put up a link tree that's just the link of all the places he could find that are giving out the vaccine. So I think the idea is that our website would be a somewhat more elaborate, hopefully more comprehensive version of that. But not to disparage Matt Largy's comprehensiveness, but we are the government, so hopefully we could find out everyone that has vaccines or the ability to give vaccines. We wouldn't get in the scheduling business. We would just sort of have one central place with answers and places people could go. And then also, I think very importantly, a place for people to sign up to volunteer so that we could help with the general effort of APH. And to that end, I know that on Thursday, and I would encourage anyone, all the folks on this call to join or do something similar. We're actually going to have a phone bank with the mayor and myself, and Council Member Vanessa Fuentes has also agreed to be there to call people in the hardest hit zip codes, alert them to the fact that they can register on the APH site to register to get in line to get a vaccine. So I think that efforts like that, hopefully others will employ similar efforts to get the word out to the hardest hit zip codes, people who are 65 and older, who are Latinx, African American, and might not have access to the website or see that that's up. Hopefully these phone calls will help with that effort. And with that, I will pass it back over to you and your team, the City Council, Mayor Adler.
Sounds good, Judge. Thank you. We'll do our part of the speed round here. We'll do it in district order again as well. Councilmember Harper Madison, do you have anything on the speed round?
I do. Well, I did. And then what Judge Brown just shared with us expanded on my question. So the phone bank, for example, I wasn't aware of that effort until now. So I would encourage us to, as we are going through the various initiatives that ultimately are going to feed into our shared goal, let's all know about everything that's happening all the time. I know that sounds lofty, but I think what happens when we don't all know what efforts are taking place, then we duplicate one another's time or one another's effort. And I'd say right now, our resources, our time included, are finite. So the amount of time that it would take to make certain that everybody knows what's going on so that we can all participate simultaneously is critical. The other thing that I would say, or that I originally was wanting to lean towards asking about, was volunteer efforts. I appreciate that there are a lot of folks that want to volunteer. I appreciate that we have the opportunity to utilize volunteers to further the effort, but I also have some concerns about exposing volunteers who have not been vaccinated, which is sort of one of the reasons, myself and some of the other members of a smaller coalition aimed at the Eastern Crescent and African American community specifically sort of dialed back our potential effort at just thinking through what does the practical application of that look like, given that we are putting people at risk when we, are asking them to volunteer as it pertains to COVID efforts, and they have not been vaccinated. I just want to make certain that as we are offering people the opportunity to volunteer, that we're taking the most concern and consideration around keeping them safe and around keeping the general public safe. So I just wonder if maybe we should have a tiered system for volunteers. You know, folks who have received both doses, for example, are, you know, given the information that we have, probably the least at risk, as opposed to, you know, I know a lot of folks were unfortunately exposed to COVID-19 by way of their efforts around the election, poll workers and such. And those were folks who are in the high-risk categories of people. So I just want to make certain that we're not inadvertently putting any undue pressure on the system by way of well-meaning volunteers finding themselves exposed to the virus.
Councilmember, I agree with you. I think that we do want to protect those who volunteer. And my understanding is that there's an opportunity for them to get vaccinated. Director Hayden Howard can correct me if I'm wrong on that, but I believe that is part of the process.
Yes. Basically, what we are doing is most of our volunteers will fall under the 1A because our goal was to ensure that we provided those vaccines to people in the 1A community. So it is a tier type of volunteer type system that's kind of happening right now, kind of under the EOC. And then the other thing is that we are encouraging folks that have not received a vaccine and are wanting to volunteer. We're setting up the criteria. You can't volunteer one time and receive your vaccine. So we will have the criteria where we at least want you to be able to volunteer, 3 to 4 times. And we will, the first day of your shift, provide you the vaccine, because at that point, we're putting you at risk. And so we are keeping that in mind as we're working with the volunteers.
Thank you. I appreciate that.
Thank you. Councilmember Fuentes, do you have a speed round question?
No further questions on my end. Thank you.
Thank you. Councilmember Renteria?
Yes, I just want to thank Stephanie and Dr. Escart on the job y'all been doing. I mean, it's really frustrating when we have a national government that is wasn't as transparent as they should have been, and in our state that does not let us know when they're going to distribute. I mean, here we are, a city of 1.2 million, and we've only gotten through the public health department under 13,000 doses. So I mean 14,000 doses. So it's really frustrating that such a large city and we're still just getting a very few amount allocation of vaccine to us. So I just want to say thank you for the work that y'all have been doing for us.
Thank you. Councilmember Kassar.
Can y'all talk to us about second doses? We've gotten some number of questions about how that process is going to work for those that have already received it.
Yes, they will receive an email from us. So all of the providers that provided your initial vaccine will be reaching out to you to let you know it is time for you to come in for your vaccine. And so you will go back to that provider and they will provide the vaccine to you. We will be working with Judge Brown for the folks that receive that initial vaccine and community care, so we can provide those to them as well.
Got it. So the message is hang tight and make sure to answer your email or your phone.
Yes.
Thank you.
Councilmember Kitchen.
I think this question may be for Dr. Escott. Category 1B includes individuals under 65 who have an underlying condition that leaves them at, I think it's serious risk for something or risk of serious illness or something like that. Can you explain that to folks? There's some confusion about what, I've heard from some folks who are unclear about if they can qualify, if they have certain conditions. And so when we talk about people being eligible right now under 1B, I'm assuming the things that you have just said about people signing up as 1B, I'm assuming you mean that with regard to people with underlying diseases, is that correct, or?
Yes, Councilmember. So certainly everybody in 1B should sign up. We want everybody who's interested in the vaccine to sign up, because again, we're going to keep going down the list as we get more vaccine. We'll drop the bar down and continue to offer to additional folks. What I was saying earlier is that I think Director Hayden Howard said that we have more than 65,000 who are over 65. Obviously, with 12,000 doses, it would take us 5 weeks just to get through the people currently that we have signed up over 65. So there's not much likelihood that people under 65 are going to get it in the near future from Austin Public Health. But as vaccine supply increases, that may change. So if they're signed up already and we can drop the bar below 65, then that may be an option. There are lots of medical conditions which fall under the 1B. Common ones would be significant obesity, diabetes, heart disease, chronic lung disease. But there are many other things. Immunocompromising conditions would be another large group. There's information on the 1B group on our website at Austin Public Health, as well as the DSHS website, which can provide folks further information. When they sign up for the screening, they're going to ask them questions about their medical history, which helps classify them as 1B or not. So we ask folks to answer those honestly so that we can prioritize the vaccine for those who are most likely to be severely impacted.
So just to clarify, if they are 1B because they're under 65 but they have an underlying condition, should they be getting on the list now?
Yes, they should be getting on the list now, but with the current allocations that we're getting, it's unlikely that any or many of them will be offered a vaccine spot in the short term. Director Hayden may want to jump in and provide further information, but again, because the most at risk are the 1Bs 65 or older, we're really focusing on those groups right now.
Well, some of the confusion is that I think there may be messages from the website that say register, but then they say, in one place they say keep trying to get an appointment, and in another place they say wait until you get an email. So can you clarify that process? This also relates to a recommendation or a suggestion that was made from a constituent. If you go in and register, are we, is APH then calling or emailing people in any order for them to get an appointment? Or are people who are registered just continuing to take the initiative and try to get it? In other words, how is, the way I'm hearing you say that people are taken in order, but can you just explain how that works, number one? And number two, just explain whether people should keep trying for an appointment or do they need to wait to be contacted?
So there are a couple of things that are happening. As an individual, no matter who you are, you decide you are going to use the APH portal. You go in and you register. Anyone that's on the call. Let's just walk through this example. You go in and you register. You do the screening process. And so you're finished and it says you have created a record. And so you will receive a response that tells you you can schedule an appointment now. If you do not receive that message about an appointment, that means that you're going to need to wait. You have been kind of moved over to wait right now. And so the target will be folks that are 65 years of age or older right now. That is like the number one target. However, we are also emphasizing communities of color. As far as a follow-up email, one of the things we did just to make sure that folks that went in early last week, we sent them some communication because they were the first ones that had went into the system and created those accounts. An email was sent to them about appointments being available. And so that way it gave them the ability to sign up for those appointments. However, what it does not do is if there's anyone else that may have just signed up that same day and were eligible, they too can get those appointments if they're eligible. So I just want to be clear that, even though we'll be proactive and we've sent out those emails to folks that signed up early on, someone else may get that slot before them because it doesn't close everyone that's eligible off to schedule an appointment. So both of the things are happening at the same time.
Okay. Councilmember Kelly, you have a question?
I do not have any further questions at this time. Thank you.
Thank you. And I think Councilmember Pools is not with us. She had to leave early. Councilmember Ellis, do you have a question?
I do, and I'm having a hard time narrowing down because I have so many questions. I appreciate Councilmember Kitchen's line of questioning kind of around the notification process and how people are going through the intake process. So I think you covered a lot of those angles there. I did have a question about the Federal Reserve of vaccines, and I had heard it was either all or mostly depleted. Can you tell me if that's accurate or if that's misinformation? And if indeed there is not very much backup, how quickly is it being manufactured and distributed? Can you go into some details about that?
I'm happy to give you what I know, and that's largely what I've read as well. I think what we saw was the public statement that we have reserves for the second dose. We saw that President-elect Biden's administration said, well, we're going to release all of it. And then the Trump administration said, well, we're already doing that. So I think what it sounds like to me is that the reserves for the second dose are the new manufactured vaccine. Now, again, what we're talking about in the next week to 2 weeks is the potential approval of a third vaccine, which may increase the volume of vaccine available significantly. That's the AstraZeneca vaccine, but I don't have any idea what numbers the U.S. may have available quickly for that particular vaccine or for the Moderna and Pfizer.
That's helpful, thank you. And then maybe if we're doing another briefing in the future, more details about how that might be distributed among the states could be another layer of information that's helpful to us and to the public.
Right.
Kathy?
Thank you. Councilmember Kitchen asked a question that and Director Hayden Howard, thank you for the explanation, but I need to trace that process through a few more steps. So if an individual registers in the system, do they know if they are among the ineligible? Do they get an email back saying they're ineligible?
No, we are not doing that right now because we are fine with folks signing up for us. And the reason why we're not doing that is at any point we may need to pivot and change the criteria, they can become eligible. And so then that way they can sign up. But until they receive the email that says you can schedule an appointment, at that point, we're just asking them to wait until further notice.
And so we can tell constituents who have successfully pre-registered that if they do not get that email back or that phone call, should they be expecting either one? But if they haven't yet received that, it's either because, one, they're not eligible at this stage, or two, they may be eligible but not at the highest priority level within that group that's eligible, or three, it may be because all of the available appointments are scheduled. So it could be any one of those three circumstances, and there's really no way to let them know which of those three it is.
Yes, it could be one of the three. And always remember that an appointment is assigned to vaccine.
Thanks. We'll emphasize that too in our messaging. I do know that I am hearing reports that for some people, they are able to continue to log back in the system, and sometimes appointments become available. Would you suggest, is that accurate information, or is it really just that more appointments became available and they received an email? Is that particular circumstance occurring, or is that just a misunderstanding of the situation?
More appointments become available because what we're working on is we're working on real-time data, and so we'll put the schedule out for 2 days. So the appointments that folks booked are for today and tomorrow only. And so we need to make sure to, every night we inventory our vaccine to see what we have available. And so that allows us to go ahead and send out, the rest of the appointments based upon our current inventory.
Okay. Councilmember Alter. And Stephanie, are you still with us?
I'm here. I just turned off my camera.
All right.
Can you hear me?
Yes, we can. Councilmember.
Okay, thank you.
Allison.
Thank you. So I guess I want to just try and make sure that I'm understanding what the plan is for this week. So if somebody calls, that I have a sense of where we're going, kind of summarizing what I've heard today. So if you are getting a second round vaccine, which we should start to have people who are getting their second round, they are to there will have some communication mechanism with them on that. So that's...
And Allison, you blocked out for a second.
So if you have a second round, so of people who are getting second round vaccines right now, they are supposed to go to the original provider. They need to get the same type of vaccine. They're supposed to go to their original provider. You do not have to go to APH unless you already went to APH for your first time. Is that correct?
That is correct, with the exception of the folks that went through the site that Judge Brown and Constable Morales set up. They would not go back to that site. We will be working with them to get those patients in.
Okay, and the folks who are going through the process right now who just got their first vaccine from APH, will they get a alert to sign up for an appointment for their second round when it's due in the 3 or 4 weeks?
Yes, they will.
Okay. Now, if I am thinking about my first round of a shot, if I am in 1A or 1B, or I think I am, whether I have insurance or not, the main provider right now in Travis County is APH. And you're going to go on to the APH website, which maybe when you confirm this, you can tell me what that is. And you're going to sign up and register. And you will get something at the end that says that you've created a record. And if there are vaccines and appointments available at that point in time, if they're not available, you will not be given an appointment. You might be told there's no appointments available, but that's a function of the vaccine supply. And then if you get that, you should expect an email when new appointments are available, but that those appointments could be all used up before you get to register. Is that correct?
The emails have been sent to folks that meet the criteria that signed up earlier in the process, because we're trying to make sure that we are getting folks kind of from a timestamp perspective. The folks that went in last week and the first ones that were able to get registered, but we didn't have enough vaccine, we're trying to make sure we get those as well. And that meet the criteria, yes.
Okay, so at this point, the system's creating kind of a wait list. And that wait list, you're going back to the top of that wait list. But if I happened to sign up and I was eligible and there was an appointment made available, but that time I might also be given an appointment.
That is true, yes.
And that's just a quirk of where we're at. I understand that's not ideal. I'm just trying to understand that. So if I have signed up and I'm fairly certain I'm eligible, you move down the wait list, which is a function of the supply that we're getting from the state.
We lost your question, Allison.
Can you hear me now?
Yes.
So if I sign up and I don't get, and I'm eligible, I have to just wait until APH gets back to me to tell me that I'm moved down the wait list and able to get an appointment.
Yes, and it will typically be an email.
Okay, and should I be checking back on the website?
No.
To make appointments? Okay. All right. And then tell me again the issue with the password with the .aph, because I've vaguely heard that but have not seen that written down. Under what circumstances might I have to add a .aph to my email, and where in my email would that go?
You would need to add the .aph to all usernames. So whenever anyone is going in and they're setting up their account and they're putting their username, and so maybe their email is john.doe@gmail.aph. That is your username. So it's your email plus you're adding the .aph on the username. And then you create your password, etc. And you should be able to get in.
And you do that if you have a problem, but not everyone's going to have a problem.
Well, no, I mean everyone
has to do .aph.
Yeah, but I would say, I would just tell all of your people just to go ahead and put the .aph on the end of it.
Okay, instead of the .com.
No, it's in addition to the .com.
In addition to
gmail.com.aph.
Yes.
Okay. And as soon as vaccine is available and distributed by the state to other providers, there will be opportunities to go to other providers. But as of this week, where we are at this week, we do not believe that there are vast numbers of providers that have vaccine other than perhaps for second round that people should be trying for this week.
Correct.
Okay. Thank you.
I don't have anything else other than just to note that the phone banking was something that was just offered, kind of a day of service by someone in our community yesterday. So it's like a brand new opportunity, and I think that today, Stephanie, you're talking to those people about giving them a potential script that they can use. And I appreciate you taking advantage of that offer that came in yesterday. When you have the demographics report at the end of the week, the demographics that are showing up right now on testing and on cases on our website are really good. And I think a lot of people are using those. So the dashboard is something that is easy to use and easy to get the information. So thank you for that. When you get the demographic information, I wouldn't wait just for the dashboard to be prepared. If there's a lag in time, if you have that data and can get it out, that would be really helpful. And I do like Commissioner Trevillion's suggestion that I think you picked up on and said you would do as well, to get the demographics not only for the people who actually get the vaccination, but also the demographics of the people that are in our system, so that we can see who it is that's able to access it and to get kind of pre-registered. And it'd be great if we could get that information at the end of the week, as you indicated. Thank you. And again, Director Hayden and Dr. Escott, thank you so much for what you guys are doing. Still 24/7 for you and your staff. And it's incredibly appreciated. Thank you. Judge, I'll turn the gavel back to you.
Okay, thanks. Yeah, just before we, one little thing, Director Hayden, what you just said about not providing shots at the space where people got the shots last time in the event that we did with Constable Morales and others, I think we're going to need to talk through that. And I'm just bringing it up because you said one thing that is inconsistent with what we told people at the event. I think we actually handed them a piece of paper saying, come back February 6th to this site and you'll receive your second dose. So there's 638 people that are currently planning on showing up there. So we'll need to talk offline about the change that you were mentioning. I do think it's good practice, and talking to Seton and others who've done these mass vaccinations in the past, to always schedule the follow-up appointment when you get that first shot, and that's what we did on the last one. So I think we'll need to probably provide those in the same location on February 6th, but happy to follow up with you. And overall, though, want to echo the mayor's sentiments and say thank you to you, Director Hayden, and Dr. Escott, and everybody else who's, I know, working as hard as we all can to make this a transparent and equitable and efficient process. So thanks, everybody. And Mayor, I think the way I had it in my notes here, at least, is that I'll pass it back to you to adjourn your meeting, and then I'll adjourn mine if there's nothing further.
Hi, Judge. Today still is January 19th, 21. It is 11:20. And having completed our special called meeting task, the City Council meeting is adjourned. Thank you so much for letting us join you. And I really do like, as someone mentioned earlier, doing these things jointly so that Dr. Escott and Director Hayden don't have to do it more than once. And I think it also really focuses the community attention on the importance when we all gather like this. We should find more opportunities to be doing this as well. So, City Council meeting adjourned.
Thank you, Mayor, for this.
Thanks for the joint meeting. It was a good idea, and we should do it more often.
Bye, guys.
Yeah.
Bye-bye.
And I want to thank the county staff and city staff for putting this all together. And again, thank you, Director Hayden and Dr. Escott, for being here. I look forward to hopefully doing more of these in the future as circumstances present themselves. So with that, I adjourn the meeting of the Travis County Commissioners Court at 11:20, and we will.
And Judge, that's just the joint session, correct, that you're adjourning?
Yeah, I'm sorry, just the joint session. And then we will carry on with
Thank you, everyone.
All right. So could we continue now with our regular meeting, or do we need to do something different technologically?
You can just call it to order the.
All the honky tonks, tonight we're having fun. We'll show the folks a brand new dance that never has been done. Well, I don't care who thinks we're silly. You be daffy and I'll be dilly.